Hi everyone, this is going to be a video on beginning suturing for lefties. So the instruments that we use are made for right-handed people. So left-handed people usually either have to adapt to the right-handed instruments, especially the needle holders in particular, or your hospital can order you some needle holders for left-handers. So they do make those. Not every practice has them, but they are available, and especially if you're doing a lot of suturing, then it might be something to talk to them about. But in the meantime, you should learn to adapt to the right-handed instruments because there is a little bit of a trick. So with any of these hinged instruments, whether it's needle holders or hemostats, you're going to want to hold them with your thumb and your fourth finger, just like this. And then when you ratchet it closed, which you do to clamp on to your needle at the tip. You would put your needle here at the tip to hold, and then you can clamp the ratchet so that way it gives you more control. So when you're driving the needle into your tissue, it's not going to move on you. But when you do that, when you release it, for right-handed people, what you're going to do is you push out away from you with your thumb, and then you pull towards you with your fourth finger to kind of release the ratchet, like that. So you push with your thumb, and you pull towards your body with your fourth finger in order to open it up like that. And so for the lefties, you're going to hold them the same way. You're going to hold them with your thumb and your fourth finger, and you can use your second finger, your index finger, to kind of brace it this way. So that way, as you're driving it, you can kind of give you a little bit more security and force to drive your needle and more control. So, but when you ratchet it and when you need to release it, you're just going to do the opposite. So you're going to pull towards your hand with the thumb and push away with your fourth finger, like that, to release it. So let's do it again. So you're going to pull towards you with your thumb and then push away with your fourth finger. And that's how you're going to release the ratchet. So that's how to operate your needle holders. And so when you get starting with suturing, it's just the procedure is gonna be the same. You're just doing it with the other hand. So it might be a little opposite. Okay, so I'm going to demonstrate to you with using your left hand when you're doing your throws. So what you're going to do is the red yarn closest to you, that's what you're going to keep in your right hand. In your left hand is going to be your needle holders. So now what you do for your first throw, so this is after you've placed your suture into the skin, and now you've pulled your suture through the tissue, and now you have these two ends. This end, the red end that has your needle attached, and then the green end, which is the end of your suture, which I'll lay right there. Okay, so what you're going to do is you're going to take the red suture and you're going to wrap it over your needle holders twice. And then you're going to open up the tips of your needle holders, pick up the end of the green edge, the free edge, and then you're slowly going to pull it. And so you see how it's all twisted, and that's what you want to see. So that's your first throw, and then you can let go of the green suture. So now you're going to keep your needle holder parallel to or perpendicular to your suture. Then with your right hand, now it's away from you, you're going to wrap it over. So you always want to keep it on the inside. You always want to keep your needle holder on the inside. So you want to keep it above your patient right here. So now you're going to wrap it around wrap the suture around your needle holders. Come over here and grab the free end of your green suture, and you want to pull them apart with the same tension, close to your patient like this. So you want it to be a flat knot like this. You do not want it to be like a slip knot like that. And that's if you pull it unevenly. So if you pull it equally, both sutures at the same time, you're going to get a nice square knot like that, and that's what you want. So I'm not tightening it just for the purposes of for you to see it, but this is what you want, and you want to tighten it. So then that's 2. So this is 1 square knot, and 1 suture is going to be 2 square knots. So you're going to have a total of 4 throws. So let's do this again. So you're going to have your needle holders perpendicular to your suture, and then you're going to wrap the suture around your needle holder. Come over here, grab the end of the other end of the suture, and then pull equally on both sides. And then you see a flat knot right there. And then you're going to do it one more time. So you're going to keep your needle holder perpendicular to your suture, wrap it over and around, pick up the other end, the free end, and then pull them equally. And then you get your square knot. So that's the end of square knot number 2. And then you can cut your tags, and then that's it. So then you would continue practicing this with the yarn, and then you can graduate to using real suture on the suture blocks to practice.